the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Well, you may normally not think of fun when you think of rehab. Baptist Health Rehabilitation Institute is the first in the state to use a new virtual reality system for physical therapy. So joining us this morning to explain it is physical therapist Meredith McKelvey. And Meredith, thank you so much for joining me today. I have had the opportunity to use virtual reality as a game. So fun. I've never had to have physical therapy, so I'm excited to hear about how these two are tied together.
Right.
But just first of all, explain the virtual reality system in general.
So the system that we have is the Real Immersive Virtual Reality System, and the name is fortunately very self-explanatory. So it creates an immersive environment where we use virtual reality to get the patient engaged in a game. So it's similar to other VR headsets, but these are designed specifically for rehab use.
Okay, so explain exactly how it works when a patient comes in and you put them on the virtual reality. How does that all work for them?
So it has a headset that goes around the patient, and so that's completely immersive for them. And then there are sensors that go on the patient's trunk and arms. They don't have to hold anything, so it doesn't matter if they have grip strength. They just strap on to the arms and hands. And then there is a tablet so that the therapist can see what the patient is seeing, so they can engage with them at the same time.
Sure. And how exactly does this benefit the patient?
So the games that we have on this headset are designed for things like range of motion, strength, balance, coordination. So there's lots of different things that we can work on. It's the same rehab goals that we work on with our other interventions, but just with the VR games instead.
Can all ages participate in this?
Yes. So we've used it with all different ages, all different diagnoses. We use it a lot with patients who have had strokes or brain injuries, or after surgeries, anything causing nerve damage, especially like to the upper extremities. So we've used it with lots of different types of patients.
Well, explain to how this is different, or how this therapy is different from like normal or traditional physical therapy.
So our physical therapists and occupational therapists use it for our therapy sessions. And I think the biggest difference is just how much more engaging it is.
Yeah.
So the patient doesn't feel like they're doing exercises. They feel like they're playing games. So they might push themselves a little bit harder or try a little bit more, not focus on their pain as much because they're focused on the intention of the game.
Well, this is fairly new to the Rehabilitation Institute.
It is. We've only had it for a few months. We're the first location in the state that has this system, so we're excited to be on the cutting edge of that.
Do you think that this will be a trend that then goes out to other institutes for physical therapy?
I do. I hope so. I think that it's a technology that's really useful for our population, and I can see a lot of other places adopting that technology too.
So is it just your one single location that has this, or is there multiple Baptist
We have
locations?
it at the inpatient rehabs in Little Rock, North Little Rock, and Conway, and then the outpatient clinics at Little Rock and North Little Rock both have it available too.
And explain to how patients would get access to this, or just contact you all to receive access.
So obviously no one would choose to do inpatient rehab just to do VR, but if you needed outpatient physical therapy or occupational therapy and had a choice of where you wanted to go, then you could ask your doctor for a referral to the Little Rock or North Little Rock Baptist locations.
Yeah, so viewers, don't go injuring yourselves just so you can do this virtual reality physical therapy. Meredith, is there anything else you'd just like to say about this, just entering technology to help you and your job and then your patients as well?
It's been really fun. I've been at Baptist for 5 years now, and it's been really fun to see how dedicated they are to making sure that we stay leaders in our field, and so it's exciting to have this technology and to get to watch patients use that. That's been really fun.
Just seeing the videos of the different games that y'all are able to use with your patients, it is fun.
Yeah,
I'm like,
it is. I've played them myself.
And exercise myself now, just to exercise. Meredith, thank you so much for joining me.
Thank you
Very
for having
interesting
me.
what y'all are doing
Thank
there
you.
at the Institute. Thanks for being with us today.